everyone. It's Dr. Gardner. It's 12:30. Kathy, would you suggest we start or wait a little longer?
I think we can start.
Okay. So welcome, everybody. I thank you for joining me today. Because there has been such ongoing intense media interest and public interest in the COVID pandemic and how it's manifesting in Simcoe, Muskoka, we've decided to set up a regular block of time to be able to handle and provide new information, receive questions, do it in a predictable manner for yourselves and for us. It may turn out that there are days in which we don't have a lot that's new to say, in which case it's still an opportunity for you to raise questions. The format of it, I think, will change a bit over time. Up until now, we've been reporting cases as we've received them. Also posting basic information on individual cases on our website. This has been following the province's approach. They've done that as well. We're now up to our 10th case, and I'll get into some high-level information about that case. But moving forward, we want to actually start looking at more of a case count approach, the epidemiology of it, the age range of the group as a whole, risk factors for the group as a whole, kind of pull out of the numbers, take away messages for the public, less of a focus on individual cases, more of what's happening in the total picture for our community. And we will be reflecting that in the information that we have up on our website as well. So we expect that to evolve as the pandemic evolves. And we're also going to keep you up to date as to what we've posted on our website for the general public or for different segments of the public. We know there are particular audiences that have concerns and want information, whether it be employers or in the healthcare environment or in other community settings. And so from time to time, we'll be pointing out to you what's changed on our website and what the key messages are for the public to protect themselves and to protect others. So at the end of this, I think I'll have Kathy walk through a bit of what's on our website for you. But at this point, I'm just going to focus in on just the latest case and then go to the bigger picture of the messages we'd like the public to get. So we've had one additional case now, which takes us up to a total of 10 cases. And by cases, I mean laboratory-confirmed cases. Then the most recent case we had reported to us 2 days ago, a woman in her 60s who returned from traveling overseas in the Middle East, Israel, Jordan, and Egypt over a week ago, and then developed symptoms and sought testing at the Headwaters Health Hospital in Orangeville, and has since been recovering at home in New Tecumseth. We've followed up with family contacts. There aren't other community contacts of concern. And the timing of the onset of her symptoms is such that we're not concerned about her flight being an area of exposure for her to others. To summarize, this would be a travel-related case. We've had 3 cases in Simcoe, Muskoka that I've characterized as community acquired, not linked to travel, and that therefore that really speaks to the importance of people in our community being aware that it is being transmitted in our community and they need to take the precautions that we've spoken to in order to safeguard themselves and safeguard others from becoming infected. But this particular case that I've just cited is one of the travel-related cases. So, as always, I'm very aware of the need to flatten the curve, as we say, and that means everybody abiding by the social distancing practices that we are promoting so that we can really reduce the transmission in our community and keep the numbers as low as possible to avoid overwhelming our healthcare system, to avoid the tragic circumstances that have happened in Italy and certain other European countries and originally in China. Now is a critical time for people to be doing the kinds of things we're talking about. So keeping a 2-meter distance from other people, frequent hand washing, avoiding crowds, avoiding interacting with people who are obviously ill, certainly self-isolating in the home if you develop any symptoms or if you've been identified as a contact of a case, and in which case we approach people when such happens and notify them of this. So they should find out that from us. Or if they're returning from travel from out of country, in which case they should be on home isolation for a 14-day period, and if they develop symptoms, they should be remaining in home isolation and seeking medical advice by telephone, telehealth to their primary care practitioner or to public health. We continue to have a very strong demand for information from the public, a very large number of people, very large number of calls, and we have deployed our staff to the response to the COVID pandemic. People, when they call, they should expect a long wait. It can be a couple hours or more before they can get through to us. They can also use email to us, or they can certainly check our website for information about COVID and our community, but also lots of good links to resources at Health Canada or at the Ontario Ministry of Health. So it's really up to us all at this point to abide by the social distancing practices to flatten the curve and keep this pandemic under control during this very difficult time. At this point, I'd be happy to take questions, and I think then we would have Kathy walk through content on our website.
Okay, thanks, Chuck. Maybe what we'll do is we'll for those of you who are on Saturday, we'll just sort of run down the list, maybe start with an initial question and then a follow-up and then move to the next one and so on and so forth. So, Doug, I heard from you first. Do you have a question for Dr. Gardner?
Yeah, you mentioned people that are coming back from travel, they need to self-isolate, but are you asking them to notify a local health unit that they are in fact doing that so that you have some fulsome numbers to refer to as people land in Toronto and then come back up into a different health unit?
If this wasn't such a massive event, then that would be ideal, but in fact we don't have the capacity to be following all the travelers that return to our district from travel, so we ask them to self-isolate and to monitor themselves, and if they develop symptoms, then they should consider contacting ourselves for follow-up. Even then, there'll be a long wait. And the key thing for such people, even if they develop symptoms, is to remain in home isolation. Seeking out testing is becoming very difficult at this time because of a limited access to testing. The demand greatly exceeds the availability, so our focus on testing, even in those cases, will be on individuals who certainly are developing severe symptoms, in which case they should also be looking to be assessed in the emergency department. Or people who work in healthcare or have work in environments that could expose vulnerable people. In those cases, they would definitely be priority for assessment and testing. People should remain. People who don't get tested who develop symptoms should remain in home isolation until they've fully recovered, at least 24 hours post-recovery, before venturing out.
Okay, thanks. Do you have a follow-up question, Doug?
No, that's fine, thanks.
Okay, Erica, do you have a question?
Yes, sorry. My question is about the community cases. How are they getting tested if you can only get a test right now if you've traveled?
So certainly, if people have had other exposures of concern, like they're direct contact of a case, and they develop symptoms, then they too would be prioritized for testing, particularly if they're deteriorating with severe symptomatology, or if they are a healthcare worker, they are going to be prioritized for testing. Other individuals who develop symptoms but don't have any obvious contact, at this point in time, unless they're a healthcare worker or unless they develop severe symptoms, probably aren't going to be prioritized for testing. Should definitely remain in isolation. I'd say anyone at this time, if you develop symptoms of a flu-like illness, should isolate in your home until you've fully recovered, and then another 24 hours thereafter before going out into the community again as a safeguard. Because as this transmits in the community, we will get to the point where there are potentially many others in the community who won't have an obvious link, and our ability to test them all is going to be very limited. The really key thing isn't so much testing them all, it's that they be isolated while they're recovering, that they home isolate to avoid infecting other people, and that they seek medical attention if they are developing severe symptoms.
Follow-up question, Erica?
Yes, thank you. So in the case of the regional close contact, or even the Bradford woman who you believe was community acquired, is that a case where the public health unit has reached out to them and said you might be at risk, or have they just come in and managed to get testing for severity or whatever else?
Well, certainly severe cases requiring hospitalization will be tested regardless of their contact history. And so we are aware of our community cases, community transmitted cases, because of that, because they're tested because they're severe cases. And certainly we reach out and follow up to their contacts to put them in home isolation to avoid any further transmission.
Trina, do you have a question?
Yes, thank you. Do you have any sense of the local curve and how that might look, meaning how quickly we may get to that point that you mentioned where there are people transmitting within the community more often?
So this is a question of surveillance. And in surveillance, we use data from a variety of sources to look at the picture in our community. So certainly, laboratory-confirmed cases are all reported to us from the public health laboratory that does the testing. So we know of them and will continue to know of them. And as we investigate them, following testing, we learn whether or not they're community acquired or whether they can be linked to travel or to another individual who's traveled. So we'll continue with that, and if we get more and more of those cases, it'll become apparent that it's transmitting in the community. Mm-hmm. In fact, as I said, we've had 3 of them, so to me that's a strong signal that there's transmission in the community. We'll also continue to monitor flu-like symptom presentations in emergency departments. We get lifetime data from our emergency departments on the number of people who just show up with a flu-like illness, regardless of the laboratory testing. And that can be an indication, too, of if, in fact, you get this becoming very widespread and actually resulting in a lot of illness, then we will see it in terms of emergency department visits as well. Mm-hmm. So those would be another two important indicators for us with regards to community transmission.
Okay, thank you.
Do you have a follow-up question, Trina?
No, that's fine.
Okay, how about you, Chris? You're the next on the list.
Okay, thank you, Dr. Gardner. think there's three sources of information coming out about new cases. We've got hospitals sometimes pushing out when they've received a confirmed case, as is the case with Collingwood General Marine Hospital. Just sent out something a couple of minutes ago about a second confirmed case. Province and the health unit are also sending out separate information. But can you just clarify, like the case we're talking about right now is not the same case or in any way linked to the Collingwood the General Marine Hospital case?
So to date, we've been able to work very closely both with the province and with hospitals about coordinating our messaging together so there's no confusion. I must admit that what you tell me about Collingwood is news to me, and so we will look into that. We do receive the laboratory tests at the same time as the attending physician. So, like I said, I will need to look into what you've referred to see if it's, well, just what it is it valid or not, right? But up until now, we've worked very closely to try and coordinate with both attending hospitals and the province and in our data and our messaging.
Okay. Can you maybe explain to me why the testing process is taking as long as it has? I mean, we're getting several days in delay in knowing what's happening with some of these patients.
My understanding is that the volume of testing has exceeded the capacity of the Ontario Public Health Laboratory System to keep up with at this time, and so there is some lag, up to 6 days of lag in getting the results back. They are working diligently with other hospital laboratories to build up the province's capacity to be able to do testing more quickly. But the explanation is that the demand is exceeding the supply at this time. I think I would like to give credit to Public Health Ontario in that they've actually managed to do more testing than all of the testing that's been done in the entirety of the United States.
Brett, do you have a question?
Actually, I have two. Thanks, Kathy. Dr. Gardner, first of all, we've heard from the Prime Minister just this morning reminding everybody, stay home, stay home, stay home. People in Simcoe, Muskoka, are we getting this message, or are we staying home? Or if not, how frustrated are you by that?
Certainly, it's a very important message, and it's one that we want to reiterate as well. If consider once or twice before you go out, do you really need to go out? If you're going out, you need to be exercising the social distancing, 2 meters away from crowds. Employers need to consider changes that they have to do in their work environment to make it safer for social distancing and implement work from home if they can. And the province has taken action to close schools, seating, dining in restaurants and bars, and licensed daycares, and also prohibit gatherings of 50 people or more. That certainly leaves room for other gatherings, and the municipalities chose to close their venues, which I think is excellent. But you still have certain other social gathering venues in our communities that we're looking at to make recommendations on how they can reduce their risk. And working with the police when necessary to draw this to people's attention. There's the odd instance I hear of gatherings that would be preferably avoided, sales of items that have drawn attention in certain instances and lines. Large purchases that people are doing in grocery stores can lead to lines that expose people. So I think that that's a problem that needs to be managed. I understand that some grocery stores have actually set up designated hours for seniors, which I think is an excellent thing because they're in particular at high risk of complications or death from COVID-19. So to be able to allow them a time to be able to do their shopping and then get out, I think is a really excellent innovation. I've had questions from municipalities about playgrounds and whether they should shut them down or not. My response back there was children going to playgrounds are going to have to exercise that social distancing, and that can be difficult to do, and frequent hand washing because of touching of equipment, that can be difficult to do. So if a municipality chose to close temporarily playgrounds, I would support them in that. We certainly, I would say the province has acted very quickly on this, remarkably fast, and there may be more action coming. There's more that could be done to prompt and require this kind of social distancing, and we shall see whether that comes to pass either provincially or federally. I think a lot has been done, but we need to do more. This is our opportunity now to flatten the curve. This is the point that we need to do it before it becomes well entrenched in our community. And I think it's really wise of government to be acting now. It's wise of municipalities that are considering activating or declaring an emergency for the purposes of drawing attention to this and maybe taking further action with it. Now is a time to be considering such action.
Do you have a follow-up call or question, Brett?
Yes, I do. We've heard of a lot of different health units and hospitals in different areas using commercially owned 3D printers to help supplement a shortage in supplies. Is that something the Simcoe Muskoka District Health Unit is looking at? I know Barrie has a few 3D printers.
We've been approached by some municipalities or others in the community, from the business community, that want to make donations. And so we're coordinating with Simcoe County and the Central Region for Ontario Health to receive those donations. We've been approached, for example, by the Muskoka Simcoe Dental Society to provide personal protective equipment from dental offices to be then used in healthcare settings. That was really excellent of them to do that. And so we're coordinating on how to receive them and then distribute them where they're needed. So right now, Simcoe County is setting itself up to assist with that process. And of course, we need to look at how best to do that in Muskoka as well.
Okay, Maddie, do you have a question?
No, thank you. I'm good.
Okay, Max FM.
Yes, it's Catherine. Thank you, Kathy. Dr. Gardner, how long do you see this going on, particularly in Simcoe, Muskoka, the pandemic, I mean? How many more cases do you see in the region?
So there's duration of time and there's number of cases.
Duration of time. How long do you think we're going to have to practice self-isolation and social distancing and all the rest of it?
It's a very good question because it's hard to do. It's hard to maintain. This is a new virus, so no one can know for sure. The pandemics of the past have been from influenza, and typically influenza pandemics such as the Spanish flu of 1918, 1919 lasted in 3 waves over a year and a half. It came in the spring, the winter spring, it lapsed in the summer, it returned in the fall, and then it returned again the following spring. So we could be in this in repeated waves for a long time, for months, maybe a year. I certainly hope not, but I think we have to think in terms of how can we get through something like that, collectively together. Certainly, it will be very beneficial when they develop a vaccine, but from what I read, that's at least a year away. So in the meantime, we have to make do with these public health measures, the social distancing measures. And, that's going to take a lot of leadership from all levels of government, and closely following our surveillance data to monitor it both here but also internationally. So, for example, in China right now, they've managed to get themselves down to very few cases, and they're starting to relax some of their controls, but they have to be very careful about it because it can relapse, it can come back. If the majority of the population still hasn't been infected, still doesn't have immunity, then it could easily come back. So it can be a long, difficult, and drawn-out process for us that waxes and wanes. And in terms of the absolute number of cases, we've certainly seen internationally how bad it can get in Wuhan province, China, in Italy, and now in Spain, other countries in Europe, in Iran. Really, northern Italy has been truly tragic, the number of cases they've had. Tens of thousands of cases, many hundreds of deaths, very much clustered in seniors and those with pre-existing medical conditions, but not exclusively. You can still have some young, healthy people have complications from this. So we need to act now with our public health measures to flatten the curve, to do what we can to blunt transmissions so that we don't get this huge surge that exceeds the ability of the healthcare system to respond. Our case survival rates will be much better if we can avoid a big surge, because it's a big surge that makes it very difficult to treat those with complications if you're exceeding the capacity of the system.
Max FM, do you have a follow-up question?
Yes, thank you. What more can be done? What more would you like to see being done to avoid that big surge?
I think we've done a lot. I think we still have some venues to consider, whether they need to be closed or not. And I'm well aware that places such as Italy have gone into complete lockdown, where they've taken it to a much greater degree, the degree to which people are not allowed out of their homes unless they are going to shop for food or medications, and that it's enforced by the police. That's certainly the extreme. Or Germany right now looking to prohibit more than one individual within 2 meters of each other out in the community and enforcing it. So clearly there is much more that can be done if it needs to be done. My message would be, let's do all we can with what we have now, with the measures we have before us now, to avoid having to go there.
Okay, great. James, do you have a question?
I do, thank you. And thank you, Dr. Gardner, for doing this. My question is, you referred to Italy a few times, and I've heard some speculation that, because people are locked up, there is still an increase in infections there, and that's because they're infecting within the home. So I just want to hear from you on just because you are in self-isolation doesn't mean you should be also, in communicating with your family in the home as well.
That would be pretty hard to live by, right, in a household with people. If everybody is well in the household, I don't think I'm calling for that yet. Certainly if there's somebody in the household that is ill and potentially a case, then you need to exercise infection control in the home for that individual, isolate them further within the home with the distancing from yourself and devoting a washroom for themselves and linens for themselves, and if you probably be eating separately, right? So that's certainly required if you actually have a case or potential case. But if we act now and exercise the controls now, we have a much better chance of having the course, the outcome that they've had, say in South Korea where they did much better, or Singapore where they did much better than the kind of situation that they presently have in Italy.
A follow-up question, James?
I do, thank you. So the confirmed infection rate in Simcoe, Muskoka is around 10. Obviously, I think we all know that is not a completely, appropriate number due to the fact of the lack of testing. So I don't know if you can kind of give us a wider idea of what the infection rate could be around here.
It's difficult to say. It's certainly clear to me that there are more cases than the 10. Because there always is. There's always this tip of the iceberg phenomenon with surveillance. You know of some, and you know there's others that you just don't have tests on. Either they're waiting for the results, or they have a mild symptomatology, or even possibly no symptomatology, and so they haven't come forward to be tested. It can be as many as 10 times as much of what you see, based on data from other organisms such as influenza.
Okay, thank you. Dawn, do you have a question?
I do, thank you. It's a bit related to what James just asked, but I know that modeling is incredibly difficult in a situation like this, but we're hearing numbers as high as 80% of the population potentially becoming infected at some point. Do you have any comments on that, Dr. Gardner? Is that kind of where we're headed, or can some of these measures we're putting in place try to stem that a little bit?
We applied a model that had been developed out of the University of Toronto, the Delhi Lana School of Public Health, and by that model, their projection was perhaps like a worst-case scenario, perhaps 50% of the population could be infected at some point through the pandemic. And by putting in place strong social distancing, public health measures early, you can reduce that by as much as 95%, according to the model. So instead of having over 200,000 cases, you could have much, much less, 10,000 or less cases. That still sounds like a very large number, of course, but it's considerably less than no action taken or no timely action taken, and certainly much better for the concept of flattening the curve and avoiding exceeding our capacity to respond.
Do you have a follow-up question, Dawn?
I don't. Thank you so much.
Okay. Is there anyone else on the line who hasn't yet had a chance to ask a question?
Yeah.
Oh. Cool. Okay, so why don't we start with the three of you identifying yourself?
Yeah, so Dana from Global News Barrie. I had a question sort of related, just to clarify, the modeling data you're talking about from U of T for 50% of the population. Is that within Simcoe, Muskoka, or Ontario, or where are you talking about specifically?
So this model could be applied to different areas of the province, and we applied it to our population just to answer the question, how important is it to put in place these measures? At the time that I first saw the data, we were looking at school closure, and it was before the province had moved on closing schools. We were looking at the question of should we be advising our school boards to close?
Great.
Do you have a follow-up question, Dana?
Yes, and looking sort of at the curve that everybody's talking about, when can we expect Simcoe, Muskoka to see its peak in cases, and how many cases are sort of predicted to affect the region?
So, as I'd mentioned, the model gave a worst-case scenario of 50% of the population affected at some point, like cumulatively throughout the pandemic noting that that takes place over months to possibly a year. So at some point in that period of time, you would have picked up that many people, or that many people would become affected by the pandemic, and that you could reduce that by 95% with strong and timely public health measures, social distancing measures. That's something I think about the numbers for you. The timing of this, I can't really predict. If it comes in more than one wave, you'll have more than one peak. And I would have predicted regardless if we have one peak or ones that follow, the one that we have right now would probably take place throughout the spring. We'll see if it would actually involve the summer. Often with influenza or other respiratory viruses, they decline greatly in the summer, but then can come back in the fall. So we could see, this present surge of activity taking place over the next 2-3 months, possibly, and then we'll have to see from there where it goes.
Mm-hmm. And we have another, who's our next meeting person that we haven't got to?
That'd be me.
Or me.
Go ahead. Nathan Schubert from Moose FM.
Hi, Nathan.
Hi. My apologies for arriving late. Dr. Gardner, so obviously we have our cases in Simcoe, obviously Aurelia, Barrie, and so on and so forth. But we have Muskoka just right above it. So I don't know if you're able to confirm if there are any current cases in Muskoka, but what are the risks of kind of mass spreading? Because we have a lot of concerned people up here, no assessment centers up here at the moment, and we're just kind of following the basic sanitation, social distancing, all that kind of stuff. So what can we in Muskoka expect?
So far we've had no laboratory confirmed cases in Muskoka. I think it would not be wise to conclude that you actually have no cases. I think it'd be safer to assume that there is some community transmission, and therefore everybody everywhere, including in Muskoka, needs to practice social distancing and all that we've discussed so far, the hand washing, the 2 meters distance from others, self-isolation if you develop symptoms, and follow-up. And I think it's important that people everywhere in the province assume it's coming. If you haven't seen it yet, it is coming. We are working with all health care partners throughout Simcoe and Muskoka. We are aware of work that's happening on setting up an assessment center in Huntsville and in Bracebridge, hopefully within the next week or two. They have to work through their preparations, and they have to get authorization from the province to commence operation.
Do you have a follow-up question, Nathan?
Yes. How effective do you think assessment centers are going to be kind of in the long run? Because, the health unit and hospitals have so much space. Do you think that setting up these additional spots are the most effective way to just go about trying to help people?
Well, people certainly need an opportunity to be assessed and, when indicated, tested. And it has to be done in a way that doesn't endanger the health care environment. Most family practices don't feel equipped to be able to do this well without potentially exposing other patients to COVID-19. So it's important that we set up locations where this can happen, and it's best that we also set them up so that they're not part of the emergency department, or they don't otherwise impede emergency departments from all their other work of managing all other emergencies. So I think it's quite important that we set up assessment centers to enable better access to assessment and testing.
Great.
Jessica, I think you're on board, right?
Yes, I am. Thank you. So my question is specifically about enforcement. So are there methods for people to report people or businesses who might be breaking the rules put out by the health unit?
So far, the rules have been provincial rules. We've supported the provincial's declaration of an emergency and directives. We work with the police, actually. So if somebody reports to us that there's a gathering at an establishment and it appears to be a danger, maybe greater than 50 people, for example, which is the requirement provincially, our action has been to approach the police about it and ask them to investigate, because the police, under the statute related to this, are empowered to enforce these directives from the province.
Well, yeah, okay. So I spoke with the police today, and they said they're only able to enforce rules applying to establishments, but they're not able yet to enforce rules for individuals or like businesses who might be breaking rules, like, for example, requiring a clear COVID test to come back to work. Like, the province has said that's not allowed, but who enforces that?
We've had experience with, or are prepared to act on, say, restaurants that haven't closed, for example. Or say a church gathering that's in the range of 50 people or more, right? Where it's come to our attention, we draw it to the attention of the police, and through negotiation with them, have them act on it. I at this point have no experience with other elements of the directives that have come from the province, so we'll have to take it on a case-by-case basis as we follow up. One thing we don't have the capacity for as a health unit is to act on individual complaints where somebody feels that somebody else is from at work that could be a case. Yeah. Right. We don't have the ability to follow up on that. We're aware through reporting from Public Health Ontario of every single positive laboratory case. Every individual that has had laboratory confirmation, we're absolutely aware of those and follow up on those. We've had quite a few people express concern about individuals in their workplace that they think might be a case, and there's no test to support that. And in that instance, our response is to give back general messaging that individuals should stay home if they're ill and be assessed, that employers should be sending people who show up at work ill home to safeguard the work environment, that people should be keeping their distance from everybody 2 meters, and in particular people who are ill. We try to reinforce the general messaging for most of those issues that are raised.
Okay, so I just want to, sorry, I know you're only supposed to have 2 questions. I just want to make sure it's really, really clear. So people should not be calling the health unit to report people maybe breaking the rules.
We've followed up when it's been a large gathering.
When it's been a large gathering, then you refer
or like a restaurant. We're certainly concerned about large gatherings and appreciate knowing about that, but we don't have the capacity to follow up where somebody suspects that a person is a case.
Okay. So do you don't have a phone number or anything set up for people to report stuff like that, though?
We have our general intake line.
Just a general line.
Which unfortunately is a long wait for people when they call in. Or we have email.
Okay. All right, that's helpful. Thank you very much.
You're welcome.
Is there anyone on the line who hasn't had an opportunity to ask a question?
That would be me.
TV as well. So
okay, so let's go with the female. Sorry, what's your name?
My name is Carrie from Pure Country.
Okay, thanks, Carrie. Go ahead.
Dr. Gardner, thanks for doing this. There's been some concern that we've heard about in the community about residents coming from outside the area, coming north to self-isolate or wait it out at the cottage. Is there any reason for concern about this from your perspective?
Certainly isolation is the key. If they are potentially a case, if they have symptoms, if they've had exposure and been told they need to isolate, they need to isolate. I've been aware of situations where somebody has been from another country, even they happen to be in our district, and ended up in isolation in the abode that they have here. as long as they are truly isolating themselves in a home, that should not be a problem. The problem is people going out, traveling and exposing other people when, in fact, they should be in isolation.
Do you have another question, Carrie?
Yes, I was just wondering, like, what does that do? Because there's a limited amount of, I think the concern that we've heard is that because there is a limited amount of capacity in case of actual illness or, getting sick, does that increase, like, I don't like to say that, the beds up here are meant for the people up here, but the hospitals are built based on and funded based on the population. Does this change it or put extra pressure on smaller hospitals?
It may. I think what I'm more concerned about is once you get into widespread community transmission, that just the local population alone could lead to a surge that overwhelms the system.
Right.
And so right back to people need to exercise social distancing.
Thank you.
And Mike, do you have a question?
Yeah, Dr. Gardner, are we seeing burn out of healthcare doctors, nurses with regard to equipment, for example, masks, shortages, anything of that sort? And are we seeing them being tested?
I'm just going to point out that I can hear a fair amount of background noise, and it would be best if people...
that is me. Just one moment.
Okay.
My apologies.
Yep.
Healthcare workers, masks, equipment. Are we seeing healthcare workers being tested? Are we seeing more? I know we had a case in Kitchener where 20 or 30 nurses had to go into self-isolation. What kind of thing what are we seeing in our region?
So I think your question is about, do we have enough protective equipment for employees, so that healthcare workers, so that they don't get exposed and don't have to go in isolation? Would that essentially be it?
For sure.
Yeah. Well, availability of personal protective equipment has been an issue for sure, and hospitals had to be very mindful, and other healthcare environments have had to be very mindful of limits on that, and hence I would say the interest in obtaining equipment potentially from other sources, like the very kind offer of our community dentists. And the province has had a very limited supply as well. So this is definitely an issue. And one of the things of concern is ensuring we have enough equipment. If you truly get into a big surge of cases, that would draw much more on the equipment that we have. So it's vitally important that the supply issue be solved provincially and otherwise.
Are we seeing nurses drop off, not to use that term in a negative sense, but are we seeing nurses self-isolating more across the province now and turning up positive?
So we've not had demonstrated transmission of COVID in a healthcare environment in Simcoe, Muskoka to date. We have had exposures. We had 2 cases that I've reported on already publicly at the Royal Victoria Regional Health Centre, RVH, related to inpatients that were managed that resulted in a significant number of staff being exposed and being in home isolation. But to date, we've not had any evidence that that's actually led to a transmission. I am aware of media reports from the City of Toronto of a significant number of healthcare workers that have contracted COVID-19. So clearly the potential is there, and it really speaks to the importance of, for one, flattening the curve through our actions in the community to help prevent that surge from happening in the first place, but also screening and infection control practices in healthcare settings to avoid exposure of healthcare workers and patients.
Thank you.
Okay.
Sorry, if I can just Oh, I just wanted to clarify, which would probably be helpful for all media here. I'm just noting a discrepancy with what the health unit's reporting versus the province with the most recent case. With the woman being traveled to Egypt and Israel, the health unit has also said she traveled to Jordan, whereas the province said she traveled to London. Which one's accurate?
So I would have to follow up and see if it's the same case we're referring to. There has been a lag in the posting from the province, I understand. Our case, I believe I said, was Israel, Jordan, and Egypt, all three of those countries. I don't know. We'll have to go back and look and see the details on what you're referring.
Was that you, Dana? Who asked?
Yeah. The province is saying Israel, Egypt, and London. So I was just, wasn't sure what happened there.
We'll follow up.
Okay, thank you.
Does anybody else have any follow-up questions?
Yes, I do. It's Erica from Collingwood Today.
Okay.
Dr. Gardner, further to the Collingwood case we were discussing earlier, it's my understanding it's actually a person from the GTA who was tested at Collingwood Hospital and then sent home to GTA. This is sort of the second case we know of, lab-confirmed case we know of, that occurred in a person who had at least visited the area or maybe often visits the area. The other one was Beaver Valley Ski Club member. Do you, as the Simcoe Muskoka Health Unit, follow up with anything to do with those cases? Obviously, they were here. Do you get notified and follow up with maybe the different places that they would have visited here, or is that their health unit?
So that case I did know of. We wouldn't normally be reporting that. At least to date, we haven't been reporting that because the individual in question doesn't actually live here, but certainly in working with the other health units involved, we would follow up, or we do follow up on any exposures that may have occurred in Simcoe, Muskoka, and if there are individuals here that were exposed, we arrange for them to be in home isolation. In this instance, there were not.
Okay, follow-up. Any other follow-up questions?
Sure, I'll ask one. Yesterday, the health unit just sent out some social media posts just regarding misinformation in the community. Dr. Gardner, can you just maybe address some of what you're seeing out there in terms of misinformation and how important it is to get the right information out there at this time?
So, very understandably, there's a high degree of anxiety in the community about this pandemic and how it's affecting their community. And we have found when we report on individual cases and where they live, that sometimes there's been social media posts in those communities with misinformation, telling people whose children attended a particular school that they should all be in isolation, for example, or a flood of calls to their municipal office. And I think what's really important for people to know is that they shouldn't be creating their own public notices. We proceed with finding the people who are exposed and put them in isolation. We do so quickly and effectively. If people haven't heard from us directly that they're a case or that they're a contact of a case, I would want them to be assured that they've not, in fact, had contact with a confirmed case, and otherwise continue to exercise the social distancing measures that I've been talking about that everybody should be using. So certainly there's a downside for us in giving you that kind of detailed information that you get this kind of response. And what I would rather do is go to the take-home messages overall, which is people need to be implementing social distancing for themselves, to protect themselves and to protect others.
Thank you.
I have a follow-up question on that. you say you're proceeding with finding people who are exposed and putting them into isolation quickly. Are you doing this as soon as someone is tested, or are you doing it only after the test comes back positive?
Well, there is an issue with lag. So if we don't have a positive test, then we are limited in what we can do. If we have a situation that we're aware of that's highly suspicious, like an individual that's traveled and has developed symptoms, then we can, in fact, contact those involved ahead of getting test results and advise that, at a minimum, they self-monitor. But in a number of these instances, we don't know about it till you get the test result back. So there is some lag before we're able to do that.
Further questions?
Doctor, this is Mike with CTV. That question we raised the other day about the Midland Penetanguishene Transit, anything come of that?
I'm sorry, could you say that again?
Yeah, the Midland Penetanguishene Transit, they stopped operations and extended that shutdown until Monday because of fear at the operations center by an employee that he may have come in contact with an exposed person. Any update on that from the health unit?
There's been no confirmed contact with the case in that situation.
And still nothing from Walmart in Midland?
Same thing.
Okay.
Yeah.
Beautiful. Thank you.
You're welcome.
Okay, do we, any other questions before we sign off?
So Kathy, it'd be great if you could also just give them a bit of a rundown on what's on our site. And I personally must go, but if I could leave you to that, that would be great.
Absolutely.
Best wishes, everybody.
All right, thank you, Doctor.
Thank you, Doctor.
Thank
Bye-bye.
you.
Okay, are some of you going to stay online with me? Hello?
Yes, I'm here.
Yeah, sure.
Okay. I thought you were going to drop me like a hot potato.
We want to hear what you have to say, Kathy.
Okay. So we continue to update our website, and I know there's so much information out there for people that it's easy to become sort of overloaded, right? I find myself being sort of overloaded with information. But we do try to drive people to our webpage so they can get local information. So the main page is, it's probably going to be updated by tomorrow morning, but one page that our communications people were talking about today is we have a what you can do page for people. That hopefully gives them some information. So how to protect themselves, what they can do at home. We're going to offer public signage very soon if people need to print it off. We have information there for food operators, personal service settings. We have some guidance documents, and so on and so forth. And tomorrow we're hoping to update this to have information specifically for employers and employees. We are finding as this evolves along that we have moved beyond just the general audience of the public to specific sectors who are looking for information. So I would encourage you to come to this often and take a little look around. So, for example, I think there were some questions earlier about, who people should call if they think people are not isolating themselves the way they should. So there's information on there about what that actually means that people can go to as well. So is that helpful for you? I know it's a bit speedy, but what we can do is let you know whenever we do have an update on there that might be of value or of background.
Yeah, I think that would be helpful.
Yeah, okay. Does anybody have any specific questions about it? Not really? Yep. Okay. All right. And are you, just for my own information, are you folks actually going to the web page on occasion?
Yes.
Every day.
Yep.
Mm-hmm.
Okay, good. It's nice to know